Welcome to week 2 in quality and safety in healthcare. I hope you've had a good week. There's just a couple concepts this week that I'd like to highlight. So actually, this will be a fairly short video. And starting with the model we looked at last week, where quality is the umbrella that overarches safety, effectiveness, timeliness, and the other factors, and also the triple aim, which is your IHI module for this week. This is the visual that I'd like to highlight. And when you're thinking about care, and we'll be looking at different aspects of care. We'll be looking at individual error. We'll be looking at errors in the larger group. Typically, people think of the hospital, and that's where the bulk of the safety and quality work has been done to a certain extent. But we really need to consider the whole environment and community. So, for example, there is the individual experience of healthcare that takes place in the exam room. It could be the home, it could be a school. There's the microsystem, the clinic in the school, hospital unit, the emergency department. And there's the larger organization in which that microsystem rests. But then you look at the larger environment as a whole, the community, the region, and the state. All of these are influenced by multiple factors. So somebody may have noticed that there were issues in screening for kids that need eyeglasses, and that led to a community initiative where screenings are done in the school or dental care or something like that. The system works best when we consider all of these initiatives. So it's really easy to get a tunnel vision when you're on a hospital unit or even in a clinic, but always think of these other greater factors that connect. So, for example, if your patients aren't showing up for appointments, sometimes there'll be a rule that after so many visits, the healthcare clinic may not see those patients. But is there something in the environment? Maybe the patient doesn't have transportation. Maybe a bus route has been deleted. So those things are always important to take a look at and keep in mind as we look at our different issues. So the National Safety Foundation made this white paper, which is in your readings. And an important factor to consider is, should we start treating patient safety and quality issues as a public health issue? So, for example, a fairly recent article said that if we counted patient care error on patients' death certificates, it actually would be the leading cause of death over car crashes, breast cancer, and AIDS. To do that, though, you'd have to list errors of cause of death on death certificates, and we're certainly not there yet, but certainly it is something to consider because it's a little easier to focus if it's in aggregated data, especially across the country. Public health organizations, you're seeing a lot of that in the news with the COVID-19. They're chronically underfunded, so important, such a great area, good practitioners tracking down all sorts of diseases and putting into place preventative measures. It's a good time to highlight other public health organizations in other countries. Some have very sophisticated programs that we've seen in the news lately. So hopefully when some of this pandemic is behind us, it'll be a while, but someday it will be behind us, we'll be able to learn from it and properly fund the public health organizations and have them work together. But it's a good time to look to see how they work and to compare them with other organizations. You'll talk about the triple aim, and again, that's in your module this week. It is a model that works, and our ACA has proven that to be true. It has improved access to care. A lot of health plans now cover physicals and things like that that people wouldn't have normally gone in to get if they had to pay more out of pocket. So those concepts do work. Finally, for this week, I'd like you just to consider the concept of population health and equity and public health and how it relates to Cura Personalis, which is a Marquette Ignatian Jesuit principle that means care of the whole person. And when we are looking at some of our concepts around quality and safety, we want to take care and look at that whole person and how they fit in the organization. Some say that Cura Personalis is holistic care, and I would agree. It probably also is taking a step back and looking at things like social justice and how we can do better for people in the environment. So just kind of put that in the back of your mind, this care of the whole person. You may have heard this from other professors or in readings. Other Jesuit universities, such as Georgetown and others, do use it in medical schools and things like that. So just kind of put that in the back of your mind, how that relates, and around holistic care as well. So I hope you have a good week in your schoolwork, and I'll see you back next week. Please call with or email with any questions. I'd be happy to answer. I try to answer very quickly. Take care.